right. So Patricia, good afternoon.
Good afternoon.
Yeah. I mean, I've already said your name. Maybe for the people who'll be watching this, I'm Cedric Linazwe, and I am the Director of Global Advocacy, Positioning, and Partnership at GNP Plus. And it's exciting to be here for the PLHIV Integration Summit. And you've been part of the the journey that brought us here, meaning in the research, but maybe you can also, for the people who be following this conversation, introduce yourself.
So my name is Dr. Patricia
Yeah.
Maritim. I am a implementation scientist based at the University of Zambia and the Center of Infectious Diseases Research in Zambia as well. Yeah, I came into this work through my colleague, Dr. Mumbi, who mentioned that you were looking for, you were interested in coming up with a minimum standards package.
Yeah.
Coming from the viewpoint of people living with HIV. So I'm curious about what prompted you to commission this report.
Yeah. I mean, I think it's I would say it's a long journey, but we had some kind of different moments and events that pushed this to happen so quickly. I can say, back in 2024, we did the Living conference ahead of the International AIDS conference in Munich, in Germany. And we had like 200 people attending from around the world. And one of the most dominant issues in the discussions was the, people living with HIV has been on treatment. I think it's working very well, but then they are staying alive, and the normal, as they age, we have some issues like non-communicable diseases, NCDs as we call them. And then the experience is that going into one place for the HIV services, for those who have NCDs, it's not enough. So they have to be going into different places to seek for health services. And then the integration conversation started there. We started seeing that the integration is a discussion that needs to happen, but also we were not thinking really that the aspects of integrating HIV services into primary health care would need to be like as quick as we saw it as something that probably we need to start thinking and planning and also having discussion with different partners. But then in January, with January changed the landscape in global health, also in many aspects because of the U.S. decision. We organized the summit in Nairobi, and then because of we saw how the governments were reacting on this funding issue. Integration became not something for long-term plan, but actually one of the quickest solution to the funding cut. And the networks of people living HIV really emphasize on the, idea of, they see the integration is the solution, but people also expressed some concern in terms of the gain we got from HIV response and how things and the services are organized. Yes, with some issues, but we may lose them. And then they thought, like, if we have to go that way, it will be useful for us to set some minimum that we will require should the integration really be implemented in any country. We should set some minimum requirements for the integration. So, and then for Gen Plus, that is our mandate. We have to listen to what we are being asked to do, and then we thought we should really organize this research study to kind of really understand what are the minimum requirements, what do we need to um, put forward as probably standards as well. So that's how we got here. And then I have to say, when I saw the reports, I was like, it went beyond expectation, very short, on point, with key highlights, which I believe will be very useful for people reading the reports, but also as we move forward, how this is going to be, useful at country level. But I think I've said to you off camera and records, it's a very well written, but also the articulations and the messages are very clear. So thank you so much, and actually congratulations. So I think I've talked too much, but then I will go back to you with a question. You I think it took you maybe 6 months or something to come up with this report, but also you met with different people for the key informant interview.
Yeah.
I know we have the report, and I think there was also a decision to see we need to prioritize this because these were the dominant kind of response from the people.
Yeah.
But what was your impression, so that people get also what is not written in the report from someone who kind of met all these network leaders and other stakeholders? What is your first impression when you ask the question, what did you see as not the minimum requirement, but the expectation, or is it something people were looking for to have? And also, did you um, get any sense of urgency, or any also like commonalities from the conversation? Yeah.
That's a really great question. So when talking to the different networks, I think what I got was this sense of stability, in the sense of the networks represent the lived reality of integration, working with different support groups, working across different ages. So integration, the conversation about integration, it felt like a natural progression to the work that you're already doing. And it was reflected in how, even in some of the asks that are in the report. But I think a key thing that was central to all the discussions on integration was the idea of it being equitable, the idea of it centering not just HIV specific health needs, but looking at a person living with HIV from kind of a holistic point of view, and thinking about what social needs do they also have, right? I think another thing that was current throughout the discussion was also this idea about resources, and how the different networks are trying to find ways to make sure that their work is sustained, and how they're able to ensure that they're still being a part of national community level responses when it comes to HIV. So I thought that was interesting, and it's also a way of future-proofing the work that you do. So that in the event that other shocks come about, networks are still able to play an active role. I think a thing that I found was a glaring gap is the level of participation that networks have, right? So in the discussions, it felt as though, in as much as you do play a role at national level, in governance, in designing frameworks, there's still more that networks can play.
Yeah.
And it's just a matter of what kind of strategic position can the networks be in to ensure that their role is more amplified.
Yeah. Yeah. No, I like that you say, the it's kind of setting the fact that networks are already seeing their position at country level, but also on long run, we see that we could use this type of process to lean on a network to get the direction that need to be taken by country when it comes to the needs of people living with HIV. And I'm also wondering, when you have a discussion with these people, do you think um, they they the minimum requirement is one thing. Do you see? Did you have an impression that they want to have this document and, or maybe to have these standards and then use them at country level, or do you have like any kind of because the surveys, most of people, they do this type of research and then the report is somewhere hidden, or people talk about this for a certain time and then it's gone. Did you feel like there's any expectation to have this document like agencies? Do we want to have this that can have an engagement at country level?
We did.
Yeah.
So a number of the networks raised the importance of not just doing readiness assessments,
Yeah.
but also having these readiness assessments translated into a tangible output.
Yeah.
That can be used by providers in facilities, by peers in communities, because it provides a sense of like a process map of what they can do.
Yeah.
So there are countries, based on the discussions, that have kind of have shorter, like an abridged set of asks, or an abridged memo that tells them, okay, integration is happening, this is what you should think about. But like plans that really operationalize what that should look like are underway.
Yeah.
So I think those kind of deliberate blueprints that tell you this is integration, this is what it would look like in a facility in your specific country,
Yeah.
that is rooted in like the local realities of that country.
Yeah.
I think those would be important, and it's something that the networks themselves highlighted as being either that they're involved in, they're actively advocating for,
Yeah.
or they're hoping to see developed going forward.
Yeah.
Yeah.
I want to ask something very specific, and then I mean, if you don't have the answer now, I think it'll be fine, because I remember when I was reading the report, something that really got my attention. I mean, it's not very surprising, but it's the percentage. I mean, 1,800 people it's a huge amount of people who responded to the survey. I'm getting away a little bit from the interviews, but I saw like 68% are female and 20 something percent male.
Yeah.
And I'm wondering also if this difference in percentage, we know that young women and girls are most affected in the data we have from UNAs, but also now it's reflecting in the survey we did.
Yeah.
And I'm wondering from that angle, in terms of numbers, quantitative numbers, going to the interviews, did you, because I also know that you interviewed different, a portion of representative of male, and there were networks leaders, but I think there was also gender balance in terms of male and female. And I'm wondering whether you also felt that the difference in terms of views or specific issues, how the, network leaders, if they are, people who say this, they probably I don't know if they like it, but they are male, and then they are I believe they present both issues for male and female. So is also the female leaders.
Yeah.
I'm wondering whether you had this the different views from both male and female to kind of match the quantitative data we have. Like it's a huge amount of female who responded to survey,
Yeah.
and to the qualitative data you did. Yeah.
Well, that's fascinating.
Yeah.
I hadn't really kind of thought of it in that
Yeah.
way.
Yeah.
So I don't know how comprehensive my answer will be.
Yeah. Yeah. Let's try.
I got the sense that even if they didn't articulate it like in the words that we've used,
Yeah.
a lot of the network leaders, they highlighted the value of being deliberate about gender, and not in the binarized way of just gender, like women and men, but being more cognizant that some of the populations who some of the priority populations that they serve as a network might be have varied gender expression and gender identity. So in some of the interviews, there was actually like a deliberate call for the networks to also be, as you're sitting in the rooms and thinking about how to advocate for integrated services, that it should be an opportunity to think about populations who are especially in rights constrained settings, that is typical in most African countries, to be more thoughtful of how we make sure that as we're telling governments to have comprehensive integration models, that those models also account for some of these diversities in terms of gender. Yeah. So that came out in the discussions that we had. And also, for instance, in building, one of the things we say is that with the push towards integration, there's an entire new cadre of health workers who previously had not been trained deeply in HIV care management. So there are some of these sensitivities that might not come as natural to them because of the training. So even as you're thinking about providing training for integrated services, how do you leverage that to provide sensitivity training for stigma and discrimination, sensitivity training for how to handle the needs of different types of key populations. So the conversation around different aspects of social identity came in that way. How do you think about a gendered caregiving, and what would be essential components within an integrated kind of package, right? In some of the conversations, this also came about in terms of areas that are typically overlooked when it comes to thinking about healthcare. So how do you think about deeper about, for instance, women who are undergoing menopause, and it could be women, trans men who are undergoing menopause, and it's also coming into, they also have HIV, they might also be presenting with NCDs, and how all this can affect the quality of their health and their well-being. Yeah.
All right. Do you have any question that you wanted beyond the process, but also the interest of having a report? Yeah.
I think I am curious about what, as a network, because you're sitting at like the global level, and you're part of setting this normative idea of what integration could be. I see a lot of, in my work, outside of the work I'm doing, outside of this report, we see a lot of times good intention doesn't necessarily translate. So what more can we do? you know, whether it's people living with HIV, people living with HIV networks, academics such as myself, to make sure that intention, that integration proposes to think about people living with HIV holistically doesn't just get lost in the wind, and it actually, you know, it actually becomes something that we begin to see in our communities, you know, at household levels.
Well, I think it's a tough question because I see this on 3 levels. One is, you know, for Gen Peoples, this is we got the mandate from the networks to do this, which I can also interpret that the networks are already talking about this. The people living HIV at country level, they're already talking. They see the needs, and this is the work that is done at global level, but it taking experiences and the needs from country level. So, which means we have 2 ways of moving forward. One is to really get the support from the networks themselves to lead this at country level. There is certainly going to be negotiations and advocacy at country level to say, oh, this is what we really need, or at least for a given country, given the context, because also, integration is not like a uniform. Each country have to drive they're driving it, the integration, leading the integration, depending on many factors, but the needs, at least for the people living HIV, are there. So each networks, we are expecting them to kind of lead this conversation, the negotiation with their, the government, but with a very, evidence-based, which is the report providing now, and solid arguments that is given by the report. So that is one aspect. And then for us, as much as we can, as much as the means and funding arose, we will try to kind of continue working with the country networks to push for this advocacy work. It's going to be, we know it's not like, given, but we believe that from the fact that we at least have this report as an argument, and also that legitimize our ask, we can have this type of engagement at country level. On the other side, which I think you started very well in framing the question, the normative, kind of the normative, but also the narrative, the orientation that probably some partners like the World Health Organization is looking. We want to take that mandate and continue showcasing, discussing with different partners. This is what people living HIV have been asking, and we want this to take a different step, a different level in policy, formulation, policy development, also in the different discussions that have been led by different stakeholders, global level. So for GNP Plus, we want to have, the 2 tracks. One is a country level led by networks, and we support as much as we can for this conversation to continue, the negotiations, but also the implementation when it's possible. And at global level, trying to push in different, at different level, with this argument. This is what people living with HIV are asking. Whenever you're doing a policy, whenever you're having this conversation with the counterpart at country level, keep this in mind. It's not coming from GNP Plus only. It has been, done together with the networks. Actually asked, it's an ask that is coming from a network, and then we worked with academicians to have this as a very solid evidence to push and to ask what is needed. Should every country do the integration? Please remember, people living HIV are asking, this is the minimum you can do for us. And also the minimum means, this is the minimum we can accept. We can go also higher, depending on the wills of countries. So I believe also for the academicians, as you asked for us, this is a step, a necessary step. But I also believe that when it comes to country implementation, as one example, we probably need more more on the scientific work in terms of different aspects of service provision, people-centered approach, but also at global level we need more evidences in terms of the integration. Now we are talking about starting. Some countries have at on different level, but we don't know how it will look like. You mentioned things like stigma and discrimination,
Yeah.
things like taking consideration of what the different group are asking. So there's a lot of work that need to be done, and I hope you are still much open to continue working with GNP Plus and the networks people living with HIV.
Yeah. It's been a great experience. I think coming in from I think this is probably my second year doing HIV related work at more like a systems level. So it's also been a great kind of experience working with your team on building this report and seeing how, sometimes when you have a very focused one disease focus and seeing like some of these issues, they're also resonant to other people working in other areas. So it was a really great experience working with your team and putting the report together. I think maybe as a final question, what does the future look like for you?
It's bright. So because I think we're putting this work, working with you and having this level of um, um, collecting community views and working with in more, putting evidences and having this type of reports. It means that, as I say before, we have the ability and the legitimacy to move forward with the asks that is not just GNP plus, but it's a report that is globally that collects like views and expectation from different people from different countries. So moving forward, as I say, we want to start using this as an evidence to engage at policy level with different stakeholders, World Health Organization, UNAIDS, the Global Fund, every single stakeholders that is working in HIV response, to show them this is what people are asking. And again, at country level, we need people to continue, start actually engaging their government with solid evidence that this is what we have collected. And I think also, I believe government need this type of work. It speaks more than one individual going to, this is what we need, but here we have evidences, quantitative and qualitative, aspects of what is the minimum requirement from people living HIV for the HIV integration. So we look forward to start using this as the year starts, and I believe you're gonna hear more and get feedback from different stakeholders as we share the report. And we hope it's gonna produce the impact we expected before. So thank you so much.
From your lips to God's ears.
Yes. Thank you so much.
My name is Dr. Patricia Maritim. I am an implementation scientist from the University of Zambia and the Center for Infectious Disease Research in Zambia as well.
So my name is Cedric Nahazwe, Director of Global Advocacy, Positioning and Partnership at GNP Plus, and this is PLHIV Leaders Now podcast.